Hi, welcome to this next edition of the BHH interview. Today we're at the hub with Javier de Oca. He's the CEO of IOMED, one of BHH's oldest members. So please, introduce yourself.
Hello Marja, thank you so much for having us today. As you said, I'm Javier de Oca. I'm one of the founders at IOMED and the CEO. We founded the company back in 2016, joined as a full team in 2017 and joined the hub in 2018.
Absolutely. Yes, I remember. Hey, and we're here today because we have big news to discuss. One of the biggest news items of this week is that you actually raised a 10 million investment round. So I'm very curious to know more about it, so please go ahead. What's it all about?
Indeed, yes, we are extremely happy. We managed to close 10 million Series A. We did so with the leadership of two international investors, Philips Ventures in the Netherlands and XTX Ventures in London, and also with the participation of Red Seed in Lisbon, Fondo Bolsa Social in Madrid, and also the accompanying of our existing investors, Adara, EASO, and Speed Invest. So we're extremely grateful, of course, for all of these investors joining our family here at IOMED. We're extremely excited about the new stage that we are now onboarding as a company. And we are obviously extremely grateful for you guys in the BHH for your continued support.
Of course, you're more than welcome. And what's on the horizon for IOMED in the coming years?
Well, our most important milestone right now after the fundraise is, of course, bringing our value proposition into the international stage. We are currently very active in Spain. We've managed to consolidate our position in our native market with a presence in around 20 hospitals in our country and increasingly also in Portugal. We have access to a massive database already that we are constantly curating with our tools. We, in that sense, have a very good relationship with our stakeholders, with the industry as well. And now the goal is to replicate this success, of course, in the rest of the European market. We're going to be starting with our most immediate markets, as said, Portugal, also Italy, so starting in the south of Europe, and then of course moving up north into the main markets in our continent.
So IOMED is going European.
Of course, we are.
Really nice, okay. Hey, and let's talk about technology. Can you give some examples of innovative technologies that IOMED is using?
Of course. Well, our value proposition is basically structured around three main items, I would say. First of all, it's about structuring healthcare data. In healthcare, we have a massive amount of information in the system. It's about moving that into standards, into codes, up from the text that we have in the hospitals. Secondly, it's about standardizing that information into the OMOP Common Data Model, which is a basic standard that's being extremely quickly adopted in Europe and internationally as well. And finally, it's about federating all that data in the different hospitals that participate in our network. So at the end of the day, what we have is a network of hospitals whose data is secured, stays within the hospital, of course, absolutely crucial, it's standardized, so we are sort of breaking the barriers of language, breaking the barriers of systems, breaking the barriers of different databases. And finally, of course, we are moving from text to codes, to standards, so SNOMED, ICD, LOINC, basic standards in the market. So that's our basic value proposition, right? So how is this being then used, actually? What for, right? This is currently being used in some of the biggest hospitals in our immediate environment. And this data is being activated for use cases such as, for example, clinical research. We have a variety of publications already with some of the key players and key opinion leaders in several therapeutic areas in our environment. We then have a very interesting use case called the patient journey, which helps hospitals to understand how patients flow through their system, through their care, through the continuum of care within the hospital, understanding clinical variations, understanding how those variations impact both budget and patient care and other efficiencies. And finally, we have other use cases such as, for example, what we call the patient flagging, which is help for the hospitals to ensure patients go through the right patient journey for their particular diseases. So as you can see, there is a wide variety of potential use cases for the activation of this data. Our goal here is to continuously improve those, improve the quality, and also explore new use cases, why not, in our field.
This sounds really great. I mean, it's really awesome. But I suppose when you started IOMED back in the day, in 2016, it wasn't yet this size and all this possibilities. So can you tell us a little bit how you evolved to this point?
Well, certainly was not that size. No. We were 3 people, you knew us. Now we're 50 already.
Wow.
So yeah, the evolution has been pretty much vertical, I would say. It's been a hell of a journey, I would say. It's been absolutely fantastic. The core points here is, as always, to make sure that you offer the market something the market values, right? We try to make sure of that right up from the beginning, making sure that hospitals valued what we were offering them, that the industry valued what could be done with that as well, and that we could match the basic standards around data protection, around the main trends that we are seeing in digital health at the moment, that we could fit in the preoccupations of society around data and around privacy. Combining all those factors, and of course, very thankful of the support of our investors, of institutions such as VHH, and of all of our commercial partners out there, we managed to get to the point where we are today, and we're absolutely extremely proud of the journey that we've undertaken so far.
You should be. Hey, and as you know, you're one of BHA's oldest members. I mean, back in the day, when Barcelona Health Hub started in 2018, you were one of the first 5 members, and actually today we're almost more than 500 members. So that's quite a big difference. But can you recall what made you join Barcelona Health Hub at the moment?
Well, I still recall that first meeting that we had up there at the administration pavilion, at the entrance here at the recinto. It was we were together with Christian and some major stakeholders of the healthcare environment. It was quite impressive for a first meeting where we could gather together. There were authorities, some representatives of several industries in the healthcare system, of course, hospital representatives here at San Pau, at the Recinto Modernista, and some others. So I still recall that meeting up there at that room, and we're all quite impressed about the turnout and quite impressed around obviously the venue where we are in. I mean, it was quite impressive. So it was a no-brainer for us. Absolutely, of course we have to be here. This looks like it's going to be the center of something. We nailed it.
We did it. Yay.
We nailed it. Indeed.
Really nice, really nice. Hey, and if you look at the future, to end the interview, can you tell us a bit more about what's coming up?
Bright future, Marja.
Yeah,
bright future. Both for the hub as well as for IOMED. I hope we can sit down in a year's time now and talk about how we landed in Italy, how we landed in Portugal, how we landed in some other European geographies, how we expanded our network, how we expanded our value propositions, how we expanded our team and our talent. I also look forward to sit down here and speak how we expanded the hub, how we reached new geographies as well, how we created new members, how we developed our existing ones, how we potentiate our partnerships, and so on. So, I mean, so much to do, not so much time.
Yeah, there's always a lack of time, but hey, we'll get there. We'll get there. Yeah. Hey, Javier, thank you very much for your great input today, and we hope to see you soon back with some other exciting news.
Anytime you want.
For European markets. So,
of course.
Stay tuned.
Anytime you want, Marja. Thank you so much.
Thank you very much.